Until otherwise noticed due to the determination that a public health emergency exists. The next regular meeting of the board will be held on Friday, September 30th at 9 a.m. The first item on today's agenda is employee recognition, which I believe will be reviewed by Ms. Andrea Gibson.
Yes, good morning, Chair Taylor and Board of Directors. For the employee recognition today, we have a number of people we would like to acknowledge. And I think Debbie's pulling up the slide. The first group of people are at the Cook County Department of Public Health, who was recently recognized by the National Association of County and City Health Officials and received a 2022 Innovative Practice Bronze Award for the Contact Tracing Initiative Care Resource Team. In particular, we'd like to acknowledge Dr. Darcy Moeller and Maureen Rosenbarger and Jessica Yee and the entire CCDPH team. Next, we have
For each of the city's 22 police districts.
Next, we have Dr. Jaleesa Harris, who is a Cook County Health Family and Community Medicine resident who was named to the inaugural class of the Community Leadership Fellows, a leadership development experience designed to uplift Black and Brown voices of Chicago by those who live, work, and lead on the West Side. So the program aims to cultivate leaders on the West Side to drive sustainable, vibrant communities. Dr. Harris was also a member of the American Medical Association's Leadership Development Institute cohort in 2021. And in 2017, she founded the community project Mystery Organs, where she gave cadaver organs to teach health-centered science lessons to elementary and high school age students on the West Side of Chicago. So please join me in acknowledging Dr. Jaleesa Harris. Next, we'd like to acknowledge the team that helped take care of the 13-year-old girl who was struck by lightning in Garfield Park earlier this month. The family released a statement thanking the Stroger trauma and pediatric care teams and first responders for their daughter's remarkable outcome. The family and Dr. Thomas Messer, attending trauma physician who cared for the girl, also used this opportunity to stress the importance of CPR training. The relentless application of CPR immediately after the lightning strike by both a relative and Chicago Fire EMS was essential for her swift recovery. Special recognition goes to the entire team, which included Dr. Thomas Messer, Sun Park, Stibby Abraham, Mia Masuda, and Dr. Yomi Akintoran, Dr. Nicole Francis, Ian Pino, and Maria Di Giacomo. So the family and Stroger teams also met with EMS first responders last week to thank them for their work. So we wanted to acknowledge the team and their efforts here today. And finally, we wanted to recognize our participation in the Bud Billiken Parade. This was held on Saturday, August 13th, and Cook County Health, as always, was well represented with more than 100 Cook County Health team members providing services, marching, and enjoying the Southside tradition. Both Provident Hospital and County Care had floats in the parade. So thank you to the team who participated in that parade. And that concludes employee recognition.
Andrew, thank you very much. Again, we'd like to congratulate and thank all of those acknowledged. The next item is public testimony. Madam Secretary, do we have any speakers who've registered to provide virtual oral testimony? And as a reminder, great.
Sorry, go ahead.
No, and as a reminder, written testimony will not be read into the record, but will be included in the official record of this meeting and posted to the website. Following receiving any oral testimony, the Secretary can read a list of names who submitted written testimony into the record. Madam Secretary.
And for the record, Director Munar and Director Ryder have joined us.
Thank you.
The first speaker is Angela Walker. Angela, are you present? Angela Walker?
Yes, I'm here. I'm sorry, I couldn't unmute. It's kind of difficult.
Go ahead and give your testimony.
I have something written down, so just wanted to acknowledge the fact that my name is Angela Walker, and I'm here working care coordination and I'm also an NNOC member. And I was one of the nurses who answered the call to go and serve when COVID was going on. Many of the nurses hadn't been to the bedside in many years, as myself included, and yet went to serve at the bedside to help out during COVID time. Now, there was supposed to be monetary compensation that county still hasn't given the nurses. Now, it's a small compensation that we get compensated for the work that we did when we answered the call. So that's all that I wanted to say. Thank you so much.
Thank you for your testimony. The next speaker is Shannon Word.
Hi, good morning. I hope that everyone can hear me.
We can hear you.
Fantastic. Thank you so much. I am very honored to provide this testimony for the good people at the Cottage Grove Health Center in Fort Heights. Just briefly about myself, I'm the personal counselor at Prairie State College. I provide brief counseling to the students. And so when my students need long-term care, I am so grateful that I am able to refer them to the Cottage Grove Health Center. I'm also a member of the Cottage Grove Advisory Council. The council meetings are a great way to distribute information about Prairie State, as well as to receive information and updates from the Cottage Grove Health Center. What I love most about Cottage Grove is that it's a one-stop shop for my students because it has both the medical and the mental health services. PSC students can receive the necessary help that they need, as well as to receive guidance from the financial assistance counselors, which is a huge bonus. I can always count on the Cottage Grove Health Center to respond to my inquiries. They've helped me to connect their students to their services in a very prompt manner. Lastly, I just have to say too that the staff at the Cottage Grove Center is very dependable, and they show a true care for the community and for the PSC students. Earlier this year, Cottage Grove attended a Prairie State student mental health promotion function, and it allowed the students to learn about Cottage Grove services and to have them to engage in conversations about mental health. So I am so grateful to have the Cottage Grove Center in my district. Thank you very much.
Thank you for your testimony. The next speaker is Rolanda Watson. Rolanda Watson?
Hi. Yeah, can you hear me now?
We can hear you. Thank you.
Okay, great. I've successfully unmuted myself. Hi, so I'm Rolanda Watson, and I'm a registered nurse here at Cook County. I've been a nurse here for 29 years now, and never have we seen the issues with COVID. We all know that COVID, the pandemic impacted nurses and patients, and it impacted the ability to recruit and retain staff, because during COVID, a lot of people decided that they were going to retire. It was too much to handle. We were short. We were deployed from my position. I was deployed to the ICU because I have adult ICU experience. And there were only a few of us that had that adult ICU experience in the beginning when we were very short. And when I say deployment is befitting, because it felt like I was going into battle. We got there was short nursing staff, there was short housekeeping staff, nutritional staff. So the nurses had to fill all those roles. We had to fill the roles of housekeeping because they would not come to the unit. We had to fill the roles of passing out trays because the kitchen staff would not come to the unit. We had to fill the roles of transportation because they would not come to the unit. It was such a big issue that the morale went down, but we made sure that we kept our patients happy. We wanted to make sure that Cook County had a wonderful name, that the patients did not feel the hurt that the staff was feeling at that time. So we're not asking for much when we ask you guys to give us pandemic pay for being deployed as if we were in the military. We just want to attaboy, thank you for your good work, because most of us had to work full-time jobs and do that as extra jobs. I'm an elderly nurse. I have not worked a night shift in a long, long time, but I came in and I worked a night shift every weekend to make sure that staff had support and patients had good quality care that we normally give here at Cook County. Now, at the end of this, I was crazy. I didn't know my real name because of the fact that it was very, very tiring. So we're not asking for much. We just want you guys to just recognize that nurses went the extra mile, took the extra assignment during COVID, and they're still not correctly compensated for their service. Many of these nurses have had long since left the bedside, like myself.
1 minute remaining.
Okay, thank you for that. And I just want to thank you to take the time. We just want to make sure that we want to get the morale of county nurses back. We want to make sure that we do things to start recruiting and retaining staff. And this young lady talked wonderfully about Cottage Grove. They are so short-staffed, but they're still doing the best job they can. And I'll thank you guys for my time. You have a wonderful, beautiful day.
Thank you for your testimony. The next speaker is Vernita Backus.
Good morning. Good morning. My name is Dr. Vernita Backus, and I'm the Chief Executive Officer of Friend Health and the Treasurer of MHN ACO. I am here today to offer testimony in support of the County Care Health Plan, a valued partner and boon to the communities we serve at Friend Health. Friend Health is a federally qualified health center with 17 locations spanning the south side of Chicago and suburban Cook County. Our sites include 7 medical centers and 10 community-based facilities specializing in behavioral health and substance use treatment. We currently serve more than 47,000 unique patients, meeting their needs holistically, regardless of their ability to pay. We were a leader in the COVID-19 crisis, administering tens of thousands of COVID-19 tests and vaccines coordinating thousands of outreach calls through the MHN ACO program, and quickly pivoting our operations to make care available to patients through virtual health services. Friend Health has participated in county care through the MHN ACO since its inception in 2014, serving more than 16,000 county care patients. The forward-thinking arrangement between county care and MHN ACO acts as an economic engine to our communities, which are disproportionately impacted areas, as recognized by Illinois HFS. MHN ACO is an LLC wholly owned by Cook County community providers. Together, we bring a standardized, fully integrated, community-based approach to a whole person care for the county care population. We are the provider, the care manager, and coordinated care system for county care patients. MHN ACO member owners include 16 federally qualified health centers, 6 hospitals, and their physician practices. MHN ACO is currently delegated for care management for approximately 40% of county care patients, representing 170,000 lives. Friend Health is proud to serve more than 16,000 county care patients. More than 225 MHN ACO care managers and care coordinators are workers from the community employed by our community health centers. Our work together creates community jobs. The ACO staff dedicated to county care management reside in 72 disproportionately impacted areas. And the MHN ACO has committed to spending approximately $14 million with MWBE certified organizations. Partnering with County Care through the MHN ACO has allowed Friend Health to achieve its mission of positively impacting the health of the people and the communities we serve through more.
Time has expired. Excuse me. I'm sorry. Time has expired.
Thank you.
Thank you. The next speaker is Christine Sudreth.
Good morning. This is Christine Sudreth, Community Outreach Manager for Pathlights, formerly known as Cloud Council on Aging. For 47 years, we've been a community-based service organization in the southwest suburbs, serving older adults, adults with disabilities, and their families in the 22 southwest suburban communities. Our reputation for excellence affords us opportunities to partner with respected leaders like Cook County Health Services and the Cook County Department of Public Health. Our partnerships are not only mutually beneficial, the work we do together has positive outcomes for those we serve, and it connects us to other like-minded community service organizations, allowing us to share resources and knowledge to better identify and provide support in the underserved areas we're in. We're proud to have partnered with Cook County on the County Care Long-Term Services and Supports Program at the inception of the statewide Medicaid Expansion Initiative. Our shared goal is to help members improve their well-being, avoid hospital readmissions, and return to or remain living in a community residence of their choice. Our strong and valued partnership ensures members can access medical and community benefits and services. The joint approach is critical to maintaining clients' quality of life and allowing members to thrive within their community with independence and dignity. We are thankful for this program and the leadership of the Cook County Health System through which we can achieve positive results for our clients. We're also members of Blue Island and Robbins Clinic Advisory Board, and our input is both encouraged and valued by Marcelino, Alice, and other board leaders. The meetings and emails keep us up to date on the services available locally. They raise an immediate awareness of community health concerns, and they provide us with critical health information, which we further disseminate to those within the community that we serve and aging professionals and local businesses we partner with. The advisory boards are true collaborations, and the extensive reach helps us to further embed the CBOs and Cook County Health into the communities served. Early in COVID, we partnered with Cook County Department of Public Health, scheduling homebound vaccinations for the most vulnerable residents, coordinating mobile vaccination units to meet community members where they live, and to provide extensive outreach and education. Under
1
guidance
minute
of Cook County
remaining.
Health,
Pardon? 1 minute remaining.
okay, we've increased vaccine acceptance and accessibility throughout suburban Cook County. The weekly meetings with Cook County were invaluable for subordinating the coordinated countywide approach and providing resources. We're eager to continue our work with Cook County through the Building Healthy Communities initiative this fall. We will be hosting technology classes for older adults who are not even sure where the power button is on their units. And we're doing this because we noticed during COVID especially the physical and mental health impact that social isolation had. So by doing this, we can connect them with the internet, with free devices, and help them move forward and be active and engaged in the community should they ever be homebound again. Finally, we'd like to acknowledge the value of having Alice Collins from Cook County Health and Hospital Systems on our executive board. Her strength and knowledge of the challenges faced in local communities, connections and contacts help us build outreach efforts, and she has an understanding of financial challenges faced by nonprofits as our funders' budgets are reallocated regularly. That being said, as a Pathlights employee and Cook County resident, I fully support the Cook County Health fiscal year 2023 budget. We're pleased to see the systems expanding and adding services that directly benefit our vulnerable communities by providing resources to residents, keeping them safe and healthy, especially during this pandemic. And thank you to those who stepped up and really answered the needs, especially the nursing and doctor staff.
Thank you for your testimony. The next speaker is Nasis Davis. Nasis Davis. Next speaker is Kathy Boudet.
Good morning, everyone. Can you hear me?
We can hear you.
Okay. My name is Kathleen Boudet, and I'm a registered nurse working at Stroger Hospital. For many years, you have heard from nurses about the COVID pandemic, its impact on nurses and patients, and how it has impacted our ability to recruit and retain staff. It is encouraging to hear that Cook County passed a resolution that will help recruit and retain nurses and other staff. These are actions that Cook County Health can take right now to show their appreciation for us nurses who have stayed loyal to the system and our patients. I am talking today because nurses like me who went the extra mile and took extra assignment during the first COVID surge have still not been correctly compensated for our services. Many nurses who left bedside nursing and they returned to assist fellow nurses who were overrun by COVID cases. Our contract pays a modest differential for RN who temporarily take assignments outside the classification, but management is refusing to pay us. Instead, Cook County is spending thousands of taxpayer dollars on unnecessary arbitration to avoid paying us for wages earned at the height of the pandemic. Now, if you want to know more how morale is low among nurses, it's because of the actions of the Cook County leadership. And if you want to improve the morale and to empower nurses to provide exemplary professional practice, then settle with this grievance. Remember, actions does speak louder than words. Stop calling us heroes and pay nurses what they are owed. And for this, thank you for your time.
Thank you for your testimony. The next speaker is Nasis Davis. Nasis Davis, are you present? Chair, that concludes the speaker testimony.
Thank you, Madam Secretary, and thank you to all who came forward and offered testimony. We appreciate your input. Next on the agenda are the board and committee reports. The minutes of the July 29th board meeting and August 8th special board meeting are being presented for your approval. Approval will take place in the combined motion later in the meeting. Are there any corrections or revisions to either the July 29th annual board meeting or the August 8th special board meeting minutes? Hearing none. Next, Director Garza will review the HR metrics. Director Garza.
Thank you, Mr. Chair. The Human Resources Committee met on Thursday, August 18th at 12 p.m. For the record, the next regular meeting of the Human Resources Committee will be held on Friday, November 18th, 2022 at 12 p.m. We're not planning to have the staff re-review the report from the meeting. If any additional questions are raised regarding the presentation or the metrics contained within the minutes, staff are certainly available to present whatever information people are curious about and are ready to address any questions. So we received a report from the Human Resources Officer, and that information is included in the minutes, which includes the FY22 metrics, updates on key focal areas to include resources, recruiting, technology, and retention. And I would just say that if you haven't had a chance to go through those minutes, please do. There's a lot of good work that's happening within the Human Resources Department in light of a lot of tension in the workforce economy. So there were action items. The committee considered 5 CBAs, which included an economic package, which also included wage increases and healthcare between the County of Cook and the following: Service Employees International Union, SEIU, Local 73, CTW/CLC, representing service and maintenance employees at John H. Stroger Jr. Hospital, CIRMAC Health Services, and the Oak Forest Health Center. Item 2 is SEIU Local 73, CTW/CLC, representing healthcare professionals. Item 3, CEIU Local 73, CTW/CLC, representing hospital technicians and technologists at the John H. Stroger Jr. Hospital, Providence Hospital, and CIRMAC Health Services. Item 4, International Brotherhood of Teamsters Local 700, representing Stroger Hospital, police sergeants and the police sergeants/investigators. And then finally, Cook County Pharmacy Association, Chicago Joint Board /Retail Wholesale and Department Store Union, RWDSU Local 200, representing administrative staff. The CBAs were fully reviewed by the committee in a closed meeting and were recommended for approval by the committee. The CBA materials will not be re-reviewed today, but if any directors have questions on the CBAs, we'll hold off on approving the minutes until the questions are addressed in closed session later this morning. Otherwise, if there are no questions on the CBAs, the minutes are being presented for approval to be included in the combined motion that will be made a little later this morning. Upon approval of the minutes, that confers board approval of the CBA contained within the minutes. Are there any questions that need to be addressed in closed session? Okay, hearing none, we will hold for combined motion or after the closed session if there are any questions that do come up later on the CBAs. Mr. Chair, that completes my review.
Thank you, Director Garza. Next, yes, Madam Secretary.
Oh, I apologize. I didn't say anything.
Okay, I thought I heard something. Next, Director Munar and Aaron Galena, Chief Administrative Officer of Health Plan Services, will now review the Managed Care Committee metrics. The committee did not meet this month, so those metrics are being presented directly here to the board.
Thank you, Chair. Thank you, Mr. Galena. Please present your metrics.
Good morning, directors. Starting this morning with membership, total members through August was approximately 429,000. And we continue to see membership empaneled to Cook County Health Clinics at approximately 43,000 members. On the next slide, you see the market share data. We continue to increase slightly in total market share. This is at 32.7%. This data is through July. You'll note our membership in July was 435,000 compared to the 429,000 that I just mentioned for August, and I'll speak to that in just a moment on the next slide. This shows overall membership compared to the Cook County Medicaid managed care market. So you can see the past couple months, we've seen a leveling off in terms of the overall market as well as in our specific membership. So over the past 12 months, we've still outpaced the total market. We've had a 7% increase versus the overall market with a 4%. The next slide shows our trend compared to budget. And I wanted to highlight two items that have impacted membership in the past 2 months. So you can see the relatively flat membership from June to July, which was impacted. The July membership was impacted because the state reinstated a policy they had prior to the pandemic that allowed individuals 30 days to choose a health plan prior to being auto-assigned. And so effectively, there was a 30-day delay in auto-assignment that occurred between June and July, which is why you see that flattening out. In August, we were also impacted by another state activity where the state was catching up on a backlog of members that have third-party liability. In other words, members that have some other form of coverage. So approximately 6,000 members were terminated out of county care and moved to Medicaid fee-for-service because they have some sort of alternative insurance coverage, which is why you see the impact in August. That was, for the most part, a one-time adjustment because the state was catching up on a backlog of those. But our understanding is that is now cleared out. And as we look at September membership, we're seeing that we're returning back to the normal trend of growth of about 3,000 to 4,000 members a month. The next slide shows our operations metrics, which continue to be steady month over month. And then the next slide shows our inpatient utilization per 1,000. Again, I think similar to the message you've heard for the past few months that year over year, you see red, which is the prior period, compared to blue and the light blue, which is projection, that we're continuing to see lower year over year utilization within the plan. The next slide shows COVID vaccination rates. This is a little different than information you've seen in the past. We've broken this down by age demographics and to provide a little better view. We've also broken this down by the number of doses that individuals have received. And so you can really see the differences between children, especially children under the age of 12 versus older adults in the data. And then our last two slides relate to our claims payment timeliness. We continue to be right around the 30-day mark and are continuing to monitor and focus on driving down our outstanding claims. And then the last slide shows the aging breakdown of claims payments. And you can see the over 30, 60, and 90-day aging. There we go. And so the over 30-day category continues to be relatively minimal, and that's really what we focus on and ensure that we're managing to. And with that, I'm happy to answer any questions.
Thank you, Mr. Galiner. Any questions from the board?
It looks like there's one question, Director Kenny. Director Kenny, was your hand raised?
No, that was an errant clip. Sorry.
Of course.
But it is a good report. Thank you.
All right, hearing none, that'll conclude our managed care committee report. Our next scheduled meeting is for Monday, October 24th at 10:30.
Thank you. Next, Director Guggenheim will now review the Quality and Patient Safety Committee we met this month. Director Guggenheim.
Yes, good morning. The Quality and Patient Safety Committee met on Thursday, the 18th of August at 10:30 a.m. And the next meeting will be held on Friday, the 23rd of September, also at 10:30 a.m. The committee received a number of reports which are included in the minutes. These included the HRO dashboard, which described the 30-day readmission rate, the case mix index for medical and surgical DRGs at Stroger Hospital, the top box score recommended the hospital for Stroger Hospital, and the hemoglobin A1C in ambulatory patients. There was a follow-up suggested by Director Ketting that because the Stroger Hospital readmission rate bounces about from month to month, it might be beneficial to look at this in a more segmented way. But Ms. Freng noted that the data is broken down by DRGs for internal purposes. So in fact, those things are being monitored closely by staff. The committee also received an update on the subject of pediatric immunization in light of the emerging polio cases that are being found in the US. I also would like to pause and acknowledge, but alas, I can't see from the list of people who are with us today, if she's still with us, the Director of Planning and Analysis, Tara Rulin, who is going to be leaving the organization. I believe today is her last day, and I didn't see her on the list. But I certainly want to acknowledge the enormous contribution she has made in recent years to our ability to analyze relevant data to track what's going on in the system. The committee had an update on the Heart Institute service line by Dr. Rami Dukhi, who's the chair of cardiology. And again, an overview of the presentation is included in the minutes. We received from the executive medical staff at Stroger Hospital and Provident Hospital the accounts of staff action items that were before those particular bodies, and quality committee summaries from both hospitals, and the medical staff presented the medical staff appointments, reappointments, and changes. And one item was presented as a new Stroger Hospital Division Chair, which is the initial appointment of Dr. Ina Mahapatre as the Division Chair of General Internal Medicine. And the committee didn't go into closed session, so the minutes are here presented for the board's consideration as part of the combined motion to be made later in the meeting. Sorry, I'm losing my voice.
No worries. Thank you very much.
Sorry, that's on, I believe that's supposed to be September 18th. We're planning to have staff re-review reports and contracts from the meeting. While you're reviewing the minutes, Deb will have a slide reflect with a list of the contractual requests greater than $1 million. If any additional questions are raised, Charles, Pam, the staff will present and be ready to address. The committee considered the following action items, which are included in the minutes. Approve the request to execute a lease agreement with the City of Blue Island for use of the parking lot adjacent to the Blue Island Health Center. Conditionally approve 47 contracts and procurement items. Number 23, 28, 29, and 41 and 43 are pending review by contract compliance. On the screen, you'll see the contractual requests from the Finance Committee meeting whose fiscal impacts are greater than $1 million, which are highlighted for your information. Dr. Hasbrook indicated that he's going to provide a summary of interventions for the Building Healthy Community grant-related work, including the following information: a number of vendors providing services under the grant that serve minority communities, and number of minority vendors providing services under the grant. And it's my understanding that the request was fulfilled and info was provided shortly after the meeting. With regard to request number 23, Blackhawk Medical Transportation, it was noted that the contract is being amended to include a standby ambulance service at Providence Hospital. However, if the services aren't needed for that, or if there's an operational delay, there's a termination for convenience clause included in the contract, and the administration will evaluate as necessary up to and including termination of those services are not needed. We received and filed grant award related items. We recommended approval of the proposed Cook County Health fiscal year 23 preliminary budget. 2 public hearings on the preliminary budget were held on August 10th and 11th. Summary of information and list of speakers from the public hearings are included in an addendum to the August 18th Finance Committee meeting. We recommended the approval of the proposed 3-year financial forecast for the fiscal 2023 through fiscal year 2025 strategic plan. Both the preliminary budget and the fiscal forecast items are separately listed on the agenda, and Pam Casaro will provide an overview of them later in the meeting. The committee received the following reports, which are also included in the minutes: Minority and Women-Owned Business Enterprises report and a report of June 2022 year-to-date financials. And just to update, I believe the next meeting of the committee, I had it wrong earlier, is going to be September 23rd at 9 a.m. Is that correct, Deb?
That is correct.
Okay. The action items, reports, and presentations from the committee meeting are included in the meeting minutes. If there are no other questions on the information, the meetings are being presented for the board's consideration as part of the combined motion to be considered to be made later in the meeting. And again, if there are no other questions, Mr. Chairman, that's all I have.
I think you may be on mute.
I am on mute. Thank you. There you go. It's Friday. We do have, thank you, Director Ryder. We do have one contract being presented directly to the board for consideration. Dr. Rudy Kamaplali, Director of Stroger Hospital, will provide an overview of the item. I think another doctor may be to support as well.
Thank you very much, Chair Taylor, and good morning, Board of Directors. So I'm here before you to request an increase in contract amount to the tune of $274,750 not to exceed that for financial year 2022. And this is with a company, an Illinois company, Cofell Medical Supplies Incorporated. And this is to provide products and services for our peritoneal dialysis program. Now, we previously had come before you at the end of last year for a 12-month contract from January 1, 2022 through December 31st, 2022. And this was for a sum of $149,000. So I'm very pleased to actually come here asking for an increase for one simple reason. This is because the program has been an immense success, and this is providing critical and important hemodialysis, peritoneal dialysis services to our patients. Now our end-stage renal dialysis patients actually have a choice between doing peritoneal dialysis where they can do it at home or having to come and do hemodialysis in the hospital before, or in the outpatient centers. Before, we just had hemodialysis services. So to be able to have a successful peritoneal dialysis program is great, and one that is actually growing quite rapidly is exciting. We currently have 16 patients. We hope to end the year with 24 patients, because we intend to recruit about 2 patients a month. So the simple request is to increase the current sum from $149,000 to a sum not to exceed $74,750. and this is for contract number H22-250027. With that, I'm available to take any questions you may have.
Thank you, directors. Do we have any questions regarding the request? Dr. Kambali, just one question I have is you think you've indicated that we're enrolling more into the program. What would be the ultimate goal in terms of percentage or number of patients served or percentage of the population that needs the service?
I will defer to Dr. Hart for that. We've been targeting 2 patients a month, and with a goal of 24 a year. But I'm calling on Dr. Hart, our chair of Department of Nephrology and interim chair of medicine. About what proportion of patients would this be in relation to our end-stage renal disease patients who need renal replacement therapy?
Good morning, Chairman Taylor and the directors. Our patients are disproportionately affected by end-stage renal disease, particularly a minority population. Approximately, in most dialysis units, 7 out of 10 patients who have end-stage renal disease due to diabetes and hypertension. In terms of percentages, significantly, we think about 70 to 80% of these patients progress to end-stage renal disease. And the best practices we have is to offer them hemodialysis and peritoneal dialysis. Currently, 1 out of 4 of our patients do have peritoneal dialysis. We want to expand and grow this program so that the choice between HD, hemodialysis, and peritoneal dialysis PD is really 1:1. One major advantage for PD is that it's home-based and their quality of life is significantly improved, and they do return to work and become productive citizens because of peritoneal dialysis. Thank you.
Thank you. Very helpful. Directors, any further questions? If not, thank you, doctors. We'll move to approval in the later in the meeting. The next item are the preliminary budget and 3-year financial forecast presented to the board for consideration. Both items were recommended for approval by the Finance Committee. Pam Casara will provide an overview of the items. Pam?
And Chair Taylor, before Pam starts, for the record, Director Prendergast is present. She arrived back when we were getting public testimony.
Oh, perfect. Welcome, Director Prendergast and all directors. Thank you.
Thank you, Chairman Taylor. Good morning, directors. Pam Casara, Chief Financial Officer. So I am happy to present the preliminary fiscal year 23 budget. We are presenting a balanced budget. As a result of the public health emergency and ongoing COVID response and the challenges surrounding the tight labor market, we've taken a very conservative approach to the fiscal 23 budget, and much of the fiscal 23 budget is the continuation of things we started this year. On this slide, you can see the general overarching assumptions we used in the budget. We did start with the 2021 volume as the baseline, layered in increases in surgical cases and procedures at Stroger and Provident, and an increase in ED and ICU at Provident, both of those primarily around the strategy of reopening the ambulance runs at Provident. Continued ramp up of the new service line initiatives we started this year with cardiac, neuro, and cancer. We layered in a 3% increase for the county care per member per month capitation rate, and did assume redetermination will begin and use an average membership of 390,000. The county is going to increase our tax allocation 10 million next year to help cover correctional and public health costs and charity care. And we layered in our newly eligible undocumented population who will be able to apply for a Medicaid-like plan, and also some regulatory reimbursement changes. Next slide. So as we look at the volumes that drive the revenues on the healthcare services side, you can see, again, we looked back. We looked back to see what we did in 2020 and 2021. We looked at what our budget was for this year and where we were projected to come in. And you can see that we are not meeting our budget this year. And then took all of these new strategies, and when we layered those in to land on our 2023 budget. So in summary, we are projecting or proposing to have the budget more than this year projected, but less than this year's budget due to the challenges we've had in achieving. Next slide. As you look at the revenue around those, you can see the breakdown here again, 3.987 billion, more in line with the fiscal year 22 budget, but less than the 22 projected. And again, we're coming in higher this year related to the pandemic and the supplemental payments that we've continued to receive in the higher county care membership as a result of the pandemic. Next slide. On the expense side of things, you can see again, we are balanced 3.987, 128 million year-over-year increase, modest increases by department and office, which we'll talk about as we go through each office's slide. And then on the position side, basically flat net 44 increase coming primarily from the public health line, which is some grant positions that are coming off grant funding and will be added to the health fund. So as we go through the next slides, we will go through each office quickly, starting with correctional health. You can see a year-over-year increase of about $6 million on the expense side. That is $6 million of the $10 million tax allocation increase to offset the ongoing costs around COVID-19 distancing and the rising number of detainees as well as mental health. And then on the position side, remaining flat. On the health administration side, 32 million increase on the expense side and a 48 position increase. Again, this is primarily driven by the 2023-25 strategic plan initiatives that the CCH board approved and the standing up of 2 new departments, the Change Institute and the Patient Experience Program, as well as strengthening across various administrative infrastructure, the big ones being human resources, and starting to transition some long-term IT contracted staff into employment with an offsetting decrease in Stroger. Next slide. Provident, a modest increase on the expense side, 8 million, basically also flat on the position side. Their strategy, again, around the restoration of the ambulance run and a full year of the ICU being reopened. Next slide. ACH and Core, again, flat on the expense side and flat on the position side. They will work on realigning and redistributing people and services across the various clinics. Next slide. And then Stroger, 31 million increase on the expense side, primarily driven by volume and inflationary increases, as well as the continued ramp up of those service lines. And then on the position side, a 52 position decrease. And again, in order to have a balanced budget, we did reduce some positions, not eliminated, no layoffs that we can repurpose through other vacancies if the need arises. Next slide. Public health, I'll start again on the top line, the health fund increasing 4 million. Again, that's 4 million of that 10 million increase in tax allocation. The remainder of their increases coming from grant funds. And you can see the top 3 grants that are driving that increase, the CDC Health Equity Grant of 12.6 million, the Local Health Protection Grant 6.4, the Community Health Worker Grant of 5.2. And then on the position side, you can see the 44 contact tracer positions that will be coming off of grant funding and being moved to the health fund, as well as the other grant funded positions. Next is the health plan services, county care. And again, county care, modest increase on the expense side, 48 million, flat on the position side, and a repeat of what we thought would happen this year for 2022. Projected membership to start to decline due to redetermination and reduction in auto assignment. Raise the average membership of 390,000 a month, increase to the per member per month capitation rate, and then the rest of their expenses to be projected to be consistent with their current trends. The next slide shows a similar slide to last year, with the membership slowly decreasing over the course of the year as the redetermination process and reduction in auto reassignment starts. And then the last slide is just the spread of the various populations across the membership across the various populations. Again, but while there are shifts between the populations, the overall membership staying at that 390,000 mark. And that concludes the presentation of the proposed fiscal year 23 budget.
Thank you very much, ma'am. And thank you for the hard work and putting, and you and the team in putting all this together, and the hosting and presenting to the various constituents, including the board, multiple times. Thank you.
Thank you.
The
next
one.
I was just going to say, the next item I'd like to present is the long-term financial forecast. This is included as a attachment or exhibit to the strategic 2023-25 strategic plan. And I'll actually start at the bottom. You can see the left column is the fiscal year 23 proposed budget. The bottom part there at 3987, you can see is the 3987 revenues, 3987 expenses is the county cash basis budget. Just a little summary of the process we use when projecting out the future years. On the revenue side, we look at on the county care membership, we work with the county on a conservative, a baseline, and an optimistic option. They look at the redetermination and the patient choice. On the hospital side, we look at the future volumes and the changes in payer mix and reimbursement rates, and then just historical trends, policy changes, and economic conditions related to the healthcare industry, and then project out what those revenues will be. And then on the expense side, similarly, they layer in the COLA and any benefit increases that they know of, supply inflationary increases, and so forth. And so what they are concluding is that our expenses will outpace our revenues without any management intervention, right? So they're projecting that we would have a deficit in the out years. But as you know, the plan would be to be a balanced budget. And so there would be management intervention to bring that back in line. The top part, the larger part of the slide shows the accrual basis are our hospital financials, which differ primarily. The cash versus accrual difference is that we budget for and include pension, depreciation, and amortization in our financials, where the county does not. Happy to answer any questions if there are any.
Do you have any questions, directors? Doesn't look like we have any. Thank you.
Thank you.
If there are no other questions on the minutes and action items being presented for consideration, we can move to the combined motion on policy. If there are any questions? Hearing none, I'd like to entertain the following combined motion to approve the following. Item 4A, July 29th board annual meeting minutes. Item 4B, August 8th special board meeting minutes. Item 4C, August 18th Human Resources Committee meeting minutes, which include the CBAs with the following: SIEU Local 73 representing service and maintenance employees at Stroger Cermak and Oak Forest Health Center, SEIU 73 representing healthcare professionals, SEIU 73 representing hospital technicians and technologists at Stroger Provident, and Cermak Teamsters Local 700 representing Stroger police sergeants and police sergeants investigators, and RWDSU Local 200 representing administrative staff. Item 4E, August 18th minutes of the Quality and Patient Safety Committee meeting, which include the Stroger Hospital Division Chair initial appointment and the Stroger and Provident Hospital medical staff appointments, reappointments, and changes. Item 4F, August 18th minutes of the Finance Committee, which include the lease agreement for the parking lot adjacent to the Blue Island Health Center, contracts and procurement items, grant award related items, and recommendations for the approval of the fiscal year 23 preliminary budget and a 3-year financial forecast for the strategic plan. Item 5A, one contract and procurement item that was presented directly. Item 4B, proposed CCH fiscal year 2023 preliminary budget, and item 5C, proposed 3-year financial forecast for the fiscal year 2023 to 2025 strategic plan. Do I have a motion?
So moved.
So moved.
Seconded.
Thank you. Madam Secretary, did you note the move and second?
Yes, that was Director Prendergast and seconded by Director Garza, I believe.
All right, perfect. Thank you. Madam Secretary, please take the roll call vote on the combined motion.
Roll call vote on the combined motion. Aye or nay. Director Curry?
Aye.
Vice Chair Deere? Vice Chair Deere? If you're present, you're muted. Vice Chair Deere? I will return to Director Deere. Director Garza?
Aye.
Director Guggenheim?
Aye.
Director Harrington?
Aye.
Director Kim?
Aye.
Director Keding?
Aye.
Director Munar? Director Munar? Director Prendergast?
Aye.
Director Ryder?
Aye.
Director Story?
Aye.
Chair Taylor?
Aye.
And returning to Vice Chair Deere? Vice Chair Deere is absent. And Director Munar? Director Munar, are you present? Okay. Chair Taylor, you have 10 yays and 2 absent.
Thank you. The ayes have it. The combined motion carries. Thank you very much. Again, I'd like to just thank the whole team, finance team, the executive team, planning team, all of the medical staff and their as well as public health team and their work to put together this budget, and actually to bring us along and in a very thorough.
Mr. Chair,
Yes.
Mr. Chair, you mark me as aye. I missed the
Okay.
vote.
Yeah, Director Deere, we will acknowledge you marking as aye. Thank you, Madam Secretary. Please make the revision.
Will do.
Perfect. Thank you. Appreciate it. So again, thanks to all of you. We really appreciate the process, and as well as our CEO, Mr. Rocha. The next item, Mr. Rocha, is your report.
Great, and good morning, members of the board. To start today, I actually want to recognize some members of our team. And so first of all, I want to recognize some new faces that you will be seeing as part of our management. And so I'll wait until we are able to just display real quickly. So if you give me 1 second. And so I want to welcome some new leaders. And so part of our new leaders, we want to welcome Zen Wu, who is one of our new hires. Zen will be our pharmacy Medicaid program manager and clinical services for Medicaid management. We also want to welcome Patricia Rayborn, Director of Patient Flow for Nursing Administration, and John Carriel, Associate Manager of Respiratory Services for Pulmonary Medicine and Respiratory Services. We also want to welcome back some members of Cook County Health who are going to be rejoining our team. And that will be Joe Salazar, Director of Centers of Excellence for our Ambulatory Care Division under Hospital Administration, and Tiffany Udell, Director of Administrative Operations for Medical Administration. And then we want to have always some congratulations for some of our team members who are assuming new responsibilities and have been promoted within our organization. We first want to start with Angela O'Banion, who will be now our Chief Information Officer and a member of the executive team at Cook County Health. Louis Daniel Jr., Manager of Environmental Services. Lily Marie Garcia, Nursing Services Business Operations Manager in Nursing Administration. Mary Garza, Director of Operations under Health Plan Services. And also on the next page, we have Nina Godina from Director of Finance, Medicare, Medicaid Operations. Peter Gustafsson, Senior Manager of Enrollment for Managed Care Operations. And Christina Torino, Senior Director of Projects and Strategic Initiatives for Health Plan Services. I see a hand that's raised.
Yeah. I'm back on the new hires, the Medicaid program manager for pharmacy. I'm curious just as what that is.
For our Medicaid program manager for pharmacy, Medicaid program manager, clinical services, Medicaid management. And so one of our biggest expenses utilization and one of the key needs that we have is to make sure that we are having all of our Medicaid services provided under our pharmacy services, as well as ordering, management, and processing of those claims. It's a very arduous task and requires quite a bit of supervision in the programs to make sure we're meeting compliant. And so this director ensures that we have all of our requirements met, that we're able to make sure that we are being compliant, that we have the medications that we need for our Medicaid population of patients, and that we are moving forward. And so it is a big task as we have a very large Medicaid population. So it reviews our plans, our claims, our ordering, our patients, and our overall processing under Medicaid programs.
Do we have similar program managers for like Medicare, or is it Medicaid just really kind of unique in that regard?
No, we have program managers for the other areas as well.
Oh, okay. Thank you.
Thank you. Next, I want to go ahead and have an update. I'm going to bring forward three of our leaders to give you an update on monkeypox. So as part of my report this morning, I will be bringing forward three individuals. First will be Dr. Wellbell, then Dr. Hasbrook, and then Ileana Mora. What I wanted to make sure as part of the CEO's report is that we give a broad review of everything that our organization is doing to be able to combat the spread of monkeypox in Cook County Health. You know, Cook County Health is a broad enterprise, and we have many different divisions underneath our larger organization. We have an ambulatory care network, we have a hospital and acute care division, and we have a public health department, a correctional health department, and we are able to also utilize a lot of our services across our health plan, our community outreach, and all of our community partners. And so today, I want to be able to showcase a little bit from each of the three areas, our acute care division and our clinical division, our ambulatory division, and our Cook County Department of Public Health, to show how we're able to bring our resources to protect the residents of Cook County against this virus. So first, I would like to recognize Dr. Sharon Wellbell, who is the Division Chair of Infection and Hospital Epidemiology.
Thank you. Thank you for giving me this opportunity. So first of all, we all know that the World Health Organization has declared monkeypox a public health emergency of international concern. That was some time ago. The United States of America and the state of Illinois followed. And here at Cook County Health, it has been declared an internal disaster. So globally, there have been, want to go to the next slide? Thank you. So globally, there have been over 45,000 cases, and this has largely been in countries that have not historically reported monkeypox virus. In the US, there are over 16,000 cases. Illinois, there's about 1,000. And in Chicago, there are over 800 cases, now with 46 hospitalizations. And at Cook County Health, we have diagnosed 77, as of today, 78 patients, and 7 of those have required hospitalization. Some good news, just yesterday, the World Health Organization stated that in the previous week, there's been a 21% decrease in the number of cases being reported globally. We've also seen this in states in the US, particularly in California and in New York, but in Chicago as well, our number of cases are declining, which is phenomenal. In terms of epidemiology, anybody can be infected by this virus, but in the 2022 outbreak, it has largely affected the gay, bisexual, queer, and other men who have sex with men population. Next slide, please. So in terms of monkeypox, we know that although it can be transmitted via respiratory droplets, this really takes very prolonged contact and is generally confined to folks who are household members of infected persons. It is largely transmitted by skin lesions and via close contact. It can be also transmitted by other bodily fluids or by sharing clothing, bedding, or towels with people who are infected. The most common symptoms that we have been seeing during this outbreak have been rash, malaise, fever, lymphadenopathy, or swollen lymph nodes. But it's been noted in a report by the Centers for Disease Control and Prevention, data up to July 22nd, that up to 42% of those persons did not have what's called a prodromal syndrome. So they basically presented with the rash and didn't have things like fever, swollen lymph nodes, and so forth, which is very important information for us as clinicians. They also found that the mean incubation period, which was generally felt to be historically 2 to 3 weeks, was found to be more like just a little over a week, 8.7 days. And that is the time from exposure to the time that we see the rash. Next slide, please. So what are we doing? We, the infection control team and others have been providing education since the end of May, beginning of June, to others, including our healthcare providers, including physicians, nurses, ancillary services, ambulatory and correctional health professionals. We have created an electronic learning module that is required by all staff to take. Early on, we also created a monkeypox intranet site that we update regularly, and we really encourage healthcare providers to look at that regularly, because just like with all new emerging pathogens, things are changing very quickly. We have trained staff on how to sample and handle lesions for molecular diagnostics, and we are sending those molecular diagnostics currently to Quest Labs as opposed to IDPH, where they were previously being sent. We really want all of our healthcare providers to understand what monkeypox virus is, how it is transmitted, how it can be prevented and treated, and to dispel myths about it. Next slide, please. So, yeah. So we, of course, are partnering with the Chicago and Cook County Departments of Public Health, as well as the Centers for Disease Control and Prevention. We have largely at the core center and the ACHN sites, Blue Island, Arlington Heights, and North Riverside, have been diagnosing regularly patients with monkeypox disease. We have provided education for folks on how to sample the lesions, as I've already mentioned, and have provided supplies. We have Janios vaccine that we're providing for our patients as post-exposure, and now as pre-exposure prophylaxis. We've given over 1,000 doses, and that's largely been at the core center because we started earlier on than the other clinics. You'll hear more about that from Dr. Horsbrook. And we also very early on, as soon as we were able, we transitioned to giving vaccine intradermally instead of subcutaneously. This was a recommendation by the FDA, where this is based on a study from 2015, where they found that one could use 0.1 mils of vaccine versus 0.5 mils of vaccine and accomplish the same immunologic response if it is given intradermally. I want to thank nursing, particularly Beth Vaklovic, who led up the training of our nurses on how to give an intradermal dosing, because my largest concern was that if this dose isn't given, if this isn't given correctly intradermally, and one goes down to the subcutaneous or even intramuscular area, then you're not going to have the this increased effect with the smaller dose. And we were very meticulous with our training and demanded return demonstration. We are also providing tecovirimat, branded as TPOXX, which is an antiviral agent. Persons can get this by appointment at the core center, again, our infectious disease facility, and at the hospital as needed. And we have given out over 50 courses of this therapy. All of the infectious disease physicians have are IRB approved for giving out this drug, as it is not an FDA approved drug, so it's on a compassionate basis. Thank you.
Good morning.
So next, I want to recognize Dr. Lamar Hasbrook to give us an update on our community outreach and education programs that and the exceptional job that the Department of Cook County Department of Public Health has been doing. But I did see a hand raised by Director Harrington. Do you want to ask your question now, or at the conclusion of the three presentations?
I can ask it. I can ask it now. I couldn't recall if she said that it was trending down or the numbers had gone down.
Dr. Wellbell?
Yeah, so there has been globally, there's been a 21% decrease in this last week in reported cases. And so they are both trending down and have gone down.
Thank you.
Any other questions for Dr. Wellbell? All right, then with that, Dr. Hasbrook.
Thank you, Mr. Rocha, and good morning to Chair Taylor and the director. So Lamar Hasbrook here, and I'm going to just kind of move out of the walls of the facility and into the community. Our jurisdiction, as you know, is Suburban Cook, and so this presentation just highlights kind of what we've been doing to reach out to protect folks in the community. So this is the classic epi curve, and you can see, although the trend line looks up overall, you can see over the last 4 cases, 4 weeks or so, it has kind of stabled out to about 14 cases a week, and the last most recent week was 8 cases. So I will also say that, the numbers change all the time. This slide represents 74. We're up to 80 cases now, and typically we average about 10% of what the city of Chicago has. And so the magnitude of the issue is 1/10 theirs. And so the resources are going to be matched appropriately. But of course, we're supplying a lot of resources and outreach to folks in a very large jurisdiction. So the numbers are slightly different here, but what you can see is that our first case was in June 24th. It's been an uptick, and now it seems to be going down, or at least stabling out. Next slide. So the epidemiology has been mentioned. Again, this is almost exclusively a male disease, as the outbreak is currently rolling out. It's exclusively kind of a young male disease, ages 25 to 54. So really the bulk of the cases, probably about 80% of the cases. Interestingly enough, in our jurisdiction, we're seeing Latino or Latinx population impacted most. This also is mirrored in the larger Chicago area as well. And then, as mentioned, this is almost exclusively a disease among men who are having sex with men or identify as such. You'll also see that about a quarter of our population does not really disclose their sexual orientation, and this has been also a trend that we've seen nationally and globally as well. So what this means, as mentioned, everyone's at some risk. We have to have blanketed outreach and approaches, but also we need to have targeted outreach and approaches as well. And that's what some of the subsequent slides will kind of emphasize. Next slide, please. So we've had a lot of activities to date, obviously working, as Mr. Rocha said, as a enterprise here, and we're working together. We've done some Facebook Live events. We've done a lot of education for providers and others. We've done a lot of pushing out to CBOs, FBOs, local electeds, and others to make sure we can direct them to the website. They can get the information they need, understanding that information is probably the most powerful antidote during any outbreak or epidemic. We've distributed marketing materials, or informational materials, I should say, taking out ads. We've done a number of things. We met most recently with the COGS. We met most recently with the Public Safety Consortium, all of the bureaus under the Office of the President that are responsible for an emergency response should it escalate to that point in time. We have made a very dynamic website and it's very synergistic with CCH's website, and as well as CPH website, because we know that folks are going to navigate different places to get their information. We want to make it user friendly, and so they're kind of seeing the same outlay of information and can kind of compare apples to apples. We've done some media and all the rest. So again, trying to get the information out. Next slide. Now, we've worked specifically with a particular commissioner, Commissioner Kevin Morrison, in making sure that we meet his expectation and the expectations of all of us in terms of targeting resources where they need to go. And so the question was, how do we activate the LGBTQ plus serving organizations so that they have the information they need, they have the vaccines that they need, the therapeutics, et cetera. And so we've reached out to 43 organizations really proactively in saying, hey, do you need help? Do you need assistance? Do you need vaccine distributions? Do you need training and all the rest? And because we are a steward of the vaccines that we get from the state, we have to be accountable for them. So it does require some negotiations, some MOUs, et cetera, so we can be accountable for the vaccine stock that we have. But we have identified 17 organizations that are really going to be, familiar with and comfortable with folks. What we also notice is that many of our folks in our jurisdiction prefer to get their care in the city. And so that's where our collaboration with CORE and others has been important. In some cases, we've had to make arrangements to backfill vaccination so that no one's turned away because of their address or their zip code. Next slide. So here are the organizations that you all that are ours that are doing this work. Next slide. Also, suburban cook providers are listed here. And again, we're constantly in touch with these folks to make sure they have what they need. Next slide. Vaccine providers that are open to our residents. So here's where we've had to kind of broker relationships and continue to negotiate to make sure everyone gets what they need, even working with IDPH to make sure they're flexible in terms of how we redistribute our vaccine allocations. Next slide. And importantly, we've had to have materials, obviously, to inform folks to really fight myths with facts. We've done this making sure we're translating all of our information into Spanish, palm cards, infographics. We have a kind of a cadence of making sure we reach all of our social media platforms, at least 3 or 4 postings a day. There's stuff that we're suggesting and recommending folks repurpose for their own needs. But again, making sure the information is out there. Folks know how to identify risk, where to go to get additional answers to their questions. Next slide. And I think that's it. I'll turn it over to Ileana Morrow.
Ileana?
Good morning. I wanted to provide an update on how our community vaccination program is going as it relates to monkeypox. We were responsive very early on at the onset of monkeypox by opening the CORE Center up for vaccination, or screening and testing, vaccination, treatment back in on July 9th. We started with the population most in need, which was post-exposure and high-risk PEP patients or community members, serving them with those services. And as of a little earlier last week, we have moved on to opening up our services to sexually active men who have sex with men. So phase 1 was really the CORE Center. The CORE Center also continues to be the location where we offer treatment services for monkeypox and where we refer in from other ACHN locations. Next slide on phase 2 is when we expanded the program to 3 of our suburban locations on August 10th. There we expanded by offering screening and testing, as well as vaccinations at our 3 locations, one north, Blue Island, one in the middle of the county, North Riverside, and in the southern part of the county, Blue Island. All of those 4 locations, if we look on the next slide, will show you the aggregated number of those that we have treated, 28, and we've vaccinated almost close to 900 as of today at those 4 locations. Moving on, our plan is on the next slide to continue to build the program and provide access at our city locations. Again, screening and testing and vaccination, and continuing to refer to treatment at the CORE Center by expanding at 2 city locations, one on the north side, Belmont Cragen, and one on the south side sink stack. Just to give you a sense of the program costs on the next slide, we are estimating that the program will cost around $5 million, with the biggest expense being around staffing. This is what we're expecting to be a 6-month run rate as of now. As I said, the biggest expense being staffing, which we have used agency to help support us with the staffing, and that is what allowed us to respond so quickly to building the monkeypox community vaccination program. Additionally, in the budget, you will see that we are launching a microsite that will provide not only information, but will provide online scheduling availability, as well as the phone scheduling that we have already gone live. Patients and community members can call directly to our vaccination hotline to get more information, as well as schedule their appointment. Additionally, you will see that much of our testing has also included the need for Quest to provide the lab services, and that is an additional expense that you see on there. And then we are hoping to do some program promotions if needed in the budget as well. Yes, Director Harrington.
You indicated we were opening a microsite. Where's that going to be located?
Correct. It's a micro website, so it's
A micro
online.
website. Oh, okay.
Yes.
Not a physical site.
Mhm.
Yeah, another
Correct.
question. This might be a question really more for Dr. Hasbro. Have we been mapping where these cases occur? Has there been a cluster or any significant cluster in any specific areas?
Dr. Hasbrook, would you like to answer?
Sure. So Director Harrington, I'm going to give you a promotion here, or a credential. Yeah, we have in our jurisdiction, we've seen very high rates in Berwyn and Cicero. So that's what we're seeing right now.
Thank you.
Any other questions I can answer before we move on? All right, thank you.
All right. So in closing, I do want to make sure that we just can show and sort of, one of the things that is a true benefit of how Cook County Health is structured is that you can see how quickly we are able to work jointly as a team. The public health department helps to be able to create those relationships with our core community centers. One of the best things that we can do to combat any virus or illness is to ensure that we're doing education, prevention, and training and reaching out to community partners and the areas that are most affected by the individuals, and then to be able to map what is occurring with our community in the spread, and then working with those partners to make sure that they have the resources they need, and they have done an exceptional job to do that. In our acute care side, and with the benefit of individuals like Dr. Wellbell, we're able to have the clinical expertise in infectious diseases pathology perspective to be able to determine, train, and educate the best resources, medicine, and what we can do to get deployed as quickly as possible, not just in our hospital and our clinics, but also in our CERMAC Health Division, which recently had a review of our monkeypox protocols with the Center of Disease Control and was found to have some of the best in class standard protocols anywhere in the country. And then we are able to bring those resources to the community where people live and work through our ambulatory healthcare network and quickly deploy to make sure that we have resources geographically spread throughout the county. And then through our internal hospital overall team, we're able to do things like microsites, campaigns, and education, and then even work with our county care plan to make sure that members who need the information get it as quickly as possible. And so while our organization is a vast organization, it also shows how we can be nimble and quickly try to make sure we're there for our community and utilize all the resources and assets so that at all different levels, we are working jointly to make sure that the Cook County residents remain safe get the assistance that they need, and are provided the ability to be able to combat this illness and future illnesses that will come forward. But so many times we do that, but don't really talk about it, and we move on to the next because we're busy. But wanted to have today's presentation just focus a little bit to show how we work together as a team. And before we go on, also have a few system updates I want to share. So on the next slide, you can just want to make sure that publicly we encourage all individuals to update their Medicaid addresses and information with the state. We always want to make sure you have your most recent updated information, especially as we're evaluating whether the public health emergency would extend and whether redetermination would begin. We want to make sure everybody has their accurate information forward. We also just are sharing with the board that we will be doing active shooter drill training in September on our Strozier campus, and then we'll be doing similar training throughout our enterprise through the rest of the fall. As part of our continuing effort to improve the member experience and consumer assessment for our healthcare provider system under our county care plan, we have added over 90 urgent care sites to our network in county care by partnering with CVS MinuteClinic, WellNow, and Physicians Immediate Care and Dispatch Health. That means that county care members now have access to 90 additional urgent care sites, expanding our network throughout Cook County. County care County care achieved also 38 million business enterprise program spend by the end of this state fiscal year. The BEP program targets investment in minority-owned and women-owned businesses. Those are our ability to contract under county care as a provider with businesses that have been identified in the business enterprise program that is investment in minority and women-owned businesses. This achievement is due to the transition of a minority-owned call center and the implementation of incentives to pharmacies and support given to 7 pharmacies to enroll in the business enterprise program and an expansion of service with existing vendors. The Providence Hemodialysis Center achieved its second profitable month in June. The measures have been taken to reduce claim denials and increase revenues. And then since the opening of the ICU at Providence, we are seeing anticipated increases in hospital admissions, resulting in an increase in daily census. For our system-wide operation updates, we also just wanted to share that we have installed digital monitors at ACHN Southern Cluster locations to display information to help and direct patients to the appropriate registration areas, as well as the display areas in Providence and ACHN. This helps patients have a smoother experience while being able to get their care. Construction has commenced at the TB clinic and Arlington Heights Health Center. This will provide for a new updated TB clinic in partnership in a partnership location site with the Public Health Department and our ACHN location at Arlington Heights. This would be the completion of this will be adding additional negative pressure rooms to be able to accommodate the TB clinic at Arlington Heights. We began offering a new pediatric specialty service at Strozier and our pediatric service line. That service line is a pulmonary sleep program that is being done in conjunction with our partnership under the University of Illinois, Chicago. We began the rollout of our cervical cancer screening program, a HEDIS metric that the Cook County Health will monitor as an organization for the first time ever, a value-added priority for women's health in our system. We are working on transitioning non-emergency transportation trips from the Cook County Health Fleet to Kaizen Health in September. This would improve and expand the availability of transportation for patients discharged, or patients who need mobility assistance on a 24/7 hour basis, ensuring that everyone can get to care and that we can provide assistance to those who need it. The Cook County Health Foundation, also just as an FYI, will be hosting its annual gala, and encourage you to contact them at cchhealthfoundation.org for more information. And that concludes my report. Thank you, Chairman.
you.
I'm sorry, this is Karen Kim. My mute unbutton thing wasn't working, so aye.
Thank you very much. That's 11 yeas, 1 absent.
All right, thank you. The ayes have it, the motion carries. We'll now adjourn here and go into closed session. We'll now move here to closed session. Thank you.